sidearm and stylus assemblies. The sidearm has micro and macro adjusting screws, as you can see in this picture. The two screws on top are macro controls. One is the vertical set screw controlling the vertical rotation movement around the bar. The other macro set screw controls the horizontal slide of the sidearm. The screw knob at the end of the sidearm controls the micro adjustments of the horizontal movement when the hinge axis location is nearly complete. The two screws on the bottom control the vertical micro adjustments of the sidearm. The stylus needs to be adjusted so it can be positioned as close to the side of the face and allow room for the stylus pencil device to be put on after the hinge axis is located for recording. Set the slide back against the stop, allowing plenty of leeway. Leave the stop on because it sometimes provides needed length to mark the hinge axis on the patient's face. Place the sidearm onto the control bar. Slide it and notice that the stylus is positioned to the stop and the sidearm is slid up to where the stylus just barely touches the tissue. This will allow enough room to attach the head frame as well as for the stylus pencil to be placed on the end of the stylus to do the tracing. Once this position is determined, the stylus is moved clear and locked in position. Repeat for the opposite side. Try to locate the stylus in the proximity of the temporomandibular joint by using the macro adjusting screws. Turn the vertical macro set screw on top to slightly snug, then slide the sidearm down out of the way and secure the head frame to the patient's head. Afterwards, move the sidearms back into position and tighten the macro set screw firmly once the stylus is approximating the hinge axis or condyle of the mandible. Again, try to position the stylus over the temporomandibular joint.